What is psychosis? The word psychosis is used to describe conditions that affect the mind, where there has been some loss of contact with reality. When someone becomes ill in this way, it is called a psychotic episode. During a period of psychosis, a person's thoughts and perceptions are disturbed, and an individual may have difficulty understanding what is real and what is not. Symptoms of psychosis include delusions or false beliefs and hallucinations, seeing or hearing things that others do not see or hear. Other symptoms include incoherent or nonsense speech and behavior that is inappropriate for the situation. A person in a psychotic episode may also experience depression, anxiety, sleep problems, social withdrawal, lack of motivation, and difficulty functioning overall. All information that enters the brain via the sensory organs is processed by the brain to form coherent thoughts that help a person behave and react in a logical, coherent way. In people with psychosis, the sensory centers of the brain may produce spontaneous reactions without any stimuli, which can result in hallucinations. The main problem in psychosis is not hallucination or delusions, but the inability to distinguish them in reality. Initial studies performed in order to understand the pathology of the brain in psychosis date back to 1935 and involved the analysis of brain structure in people with psychosis using X-ray imaging. Now obsolete, a procedure called
pneumoencephalography,
where fluids from the brain were drained out and replaced with air, was used to study the X-ray pictures of the brain. Brain scans using PET or fMRI imaging in people who have auditory hallucinations show that the parts of the brain that process speech and hearing are affected. Studies have also shown that neurotransmitters may play a role in psychosis, depression, and other forms of mental illness. Acute psychosis is primary if it is symptomatic of a psychiatric disorder, or secondary if caused by a specific medical condition. Patients with primary psychiatric disorders are likely to have auditory hallucinations, prominent cognitive disorders, and complicated delusions. Illicit drug use is the most common medical cause of acute psychosis. Clinicians should ask about recent head injuries or trauma, seizures, cerebrovascular disease, or new or worsening headaches. Schizophrenia, bipolar disorder, major depression, schizoaffective disorder, and brief psychotic disorder are the most common psychiatric illnesses that present in primary care with psychotic features. The level of consciousness and awareness are usually but not always intact in patients with acute psychosis. Secondary psychosis. What is it? Sometimes you can lose touch with reality even when you don't have a primary psychotic illness such as schizophrenia or bipolar disorder. When this happens, it's called secondary psychosis. These episodes stem from something else, like drug use or a medical condition. Classification of psychotic disorders has continued to generate debate. The idea that psychosis may be categorized into those with detectable anatomic pathology, organic, and those with such pathology, functional, has been prevalent for more than a century. In secondary psychosis, there may be cognitive difficulties, abnormal vital signs, and visual hallucinations. Traumatic brain injury, or TBI, has been proposed as a risk factor for schizophrenia-like psychosis, though there have been very few systematic studies of the relationship between these two conditions. Researchers Fuji and Ahmed conducted a review of case reports in which they retroactively applied DSM-IV criteria to a total of 69 cases and concluded that TBI can either be a primary cause of psychosis or contribute to the development of psychosis through inducing seizures. Though the study was limited by the heterogeneity of the case reports, a cohort study of 3,552 Finnish World War II veterans reported a rate of psychosis of 8.9% following TBI. But the proportion of open injuries, potential commodities, and lack of standard diagnostic tools call into question the generalizability of these findings. And case control studies indicate that TBI may marginally increase the risk of psychosis, though the increased risk factor may be significantly higher for individuals with a genetic predisposition to psychosis. The risk of psychosis appears to be elevated when TBI is severe, diffuse, involves the frontal and temporal lobes, and is associated with abnormal findings on electroencephalography and neuroimaging investigations. When psychosis does occur in the setting of TBI, it is characterized by a prominence of persecutory delusions and auditory hallucinations, with a relative paucity of negative symptoms. Given this evidence, further research examining the interaction between TBI and genetic factors for schizophrenia is warranted.